these women are producing children on a yearly basis. You can imagine the impact on the health of that woman. So as soon as NURHI came, we jumped at the opportunity that it's an opportunity for us to be able to further ensure the health status of our women and families in Oyo State.
Male involvement has really improved in the States. When you go out there to the facility, you will be surprised to see some men following their wives to the clinic. And they will come with pride. They won't feel ashamed. And when you are talking to them, when you are counseling them, you know they are ready to listen. And you even ask them to go and talk to other men out there, they are ready.
Currently in Oyo, family planning is an household word. It's no more strange to hear both the young and the old talking about family planning, at least among the women. The women, you hear them asking, have you, in local parlance, they say, Fetosebie, have you planned your family? They all have come to terms with the fact that they need to space their children and that it's better for them at the end of the day.
The issue of family planning should be a lifelong assignment. Our target is to make it a norm in Nigeria.
Planning was introduced to Ibadan many years ago, but contraceptive use has been poor due to poor funding and lack of proper information to create demand.
When we started, one of the key challenges that we have at the baseline study, we found out that myths and misconception, particularly in Oyo State, was very high. Men were not supporting their women to use family planning, thinking that it will make women promiscuous.
NURHI's strategy was to create demand through dissemination of proper reproductive health information using different channels like billboards, radio and TV spots.
Àwọn ìlànà ìfètòsọ́mọ bíbí òde òní jẹ́ ọ̀nà kan tó fọkàn ẹni balẹ̀ láti bímọ lákòókò tí a bá ṣetán láti bí wọn. Mọ̀, sọ, lọ.
88% of women who are exposed to our radio spots said they have intention to use family planning in the future. Generally speaking, in Oyo State, those women that are exposed to NURHI radio spots, they are 2 times likely to have intention to use in the future compared to those women who are not exposed to our radio jingles, our radio spots, so to say.
Community mobilization took the message of family planning from door to door through neighborhood campaigns and campaigns at key life events. NURHI also improved family planning service delivery through training of providers and renovation of health facilities through the 72-hour clinic makeover.
Was on duty on Sunday that time. So when we were at the facility, the people that left the hospital on Friday and came back on Monday, they were surprised. What really happened? They put down so many structures. They erected nice ones. All the wooden structure that we had then, the wooden partitioning for the counseling area, everything was put down. They erected nice one. They brought in so many equipments. They changed the flooring. They brought in the couches, tables, chairs for the clients, chairs for the nurses, the tables, everything. The glass cupboard, you know, there was a dramatic turnaround of the facility. It brought us joy as providers working in that place, talkless of the clients coming in.
In a normal pharmacy sector, maybe it will take like a month to get it done. And somebody is doing it in 72 hours. So it has even inculcated a new culture of operation into our mindset now.
They really tried on training. Every staff, every health worker have gone to one training or the other on family planning. Myself, I've gone to more than 5 training I did supportive supervision, long acting, I did key life.
NURHI directed advocacy efforts at religious leaders, political office holders, and policy makers through the Interfaith Forum and the Advocacy Core Group, respectively. This was to get their involvement and public support for family planning.
We met the chief imam of the whole Ibadan and other imams at Ojoba Central Mosque. It was possible for them to understand every meaning or every letter of family planning.
When NURHI started, there wasn't anything like budget line for family planning. So when we set up the advocacy core group, and then we set up what we call the BTT, the budget tracking team, and of course, with this, the training and the capacity, different capacity building that we did for these two groups, that is the advocacy core group and the budget tracking group, we began to advocate.
We try to make sure the authority allowed us to separate family planning budget from other line of budget, especially for the health department.
Local governments gave us 100,000 naira every month to purchase consumable for family planning, to distribute to 25 facilities every month. It's not enough, but just to make sure that our health facility do not tax our clients money for family planning.
Due to cultural and religious reasons, youths in the country generally have challenges accessing reproductive health information and services from health facilities. NURHI addressed this in Oyo State through a program called Life Planning for Adolescents and Youths, LPAY.
The focus of the project is to ensure that young people have access to accurate reproductive health information without bias and then without stigma attached to young people seeking information at all levels.
I'm a student and I'm a social mobilizer. Here we are in this neighborhood camp with the neighborhood of Elewiodu community, where we are doing the neighborhood campaign and we talk to the youth about how they can plan their life, how their life skills, how they can set their goals, be assertive, and how they can show their self-esteem also.
One success story that we've been able to achieve in our Oyo State is that we have now a bill that we call the Reproductive Health and Family Planning Bill that has been passed into law. And so at the local government level, all the local government where we're having our projects in 15 local governments, they are actually making funds available for family planning and they are implementing all the demand generation activity.
In Oyo State, many family planning champions have been raised to keep the flag of family planning flying long after the exit of NURHI.
NURHI has demystified the issue of family planning, even the rendering of family planning services have been made so easy, so popular through NURHI intervention.
NURHI is about living Oyo State, and they are living for good. I keep saying it, we won't miss them because they have trained us. They have handed over what we need to carry on.
Renovating the primary healthcare sector, especially using the model that NURHI has actually adopted to, is something that will help the state government even provide better quality healthcare services for the people within the state.
To express our sincere gratitude so far to NURHI for what they have been able to deliver for us and what we have evidently seen, that it is a blessing in reality, not in disguise.
Honestly, I have enjoyed the support of policymakers, for the political functionaries across the states and the local governments, all the staff who made it possible for us to get the results that we got on the field. The family planning coordinator at the state level and at the local government level, the medical officers of health, the traditional leaders, the opinion leaders, the ACG or the advocacy network, the Interfaith Forum, the media, all of these people, they are the ones that make NURHI household name in Oyo State.